Hi, hope you're all doing fine. We're launching a new video series where we'll be discussing only the important points in each video. In the sense, we'll be restricting to only 18 points per video, and these 18 points will be comprehensive. It means we'll not restrict to one particular topic or subject, rather than we'll be comprehensively covering all subjects in dentistry, right? And the reason why we chose only 18 points or 18 as a number is in order to keep the video short and to make it more interesting and also deliver quality while explaining you, right? So keeping these things in mind, we're launching this new video series, and I really hope it will be very much useful and relevant to all of you. So in this video, we'll be discussing 18 important points, right? So coming to the first one, the cyst associated with anterior crown. It's a nasopalatine cyst or incisocanal cyst. Coming to the second, the common cyst near vital mandibular anterior teeth. So it is periapical cementodysplasia, right? Third point, the basic constituent of most root canal sealers is it's zinc oxide, right? So zinc oxide forms the basic composition or component of most of the root canal sealers, right? Fourth point, aging of pulp is evidenced by increase in the fibrous component, right? So with age, the fibrous component increases. Fifth point, in normal dental pulp, which histologic feature is least likely to appear? So it's lymphocytes and plasma cells. Usually the pulp contains the self-free zone of veal, palisaded odontoblastic layer, and also we find various undifferentiated mesenchymal cells in pulp. That's a normal picture. But the rarest of the rare, in case of infection or inflammation, we find these lymphocytes as well as plasma cells, right? Now coming to the sixth point, the most common salivary gland tumor is pleomorphic adenoma. Seventh point, the action of Hawley's appliance is mainly by tipping forces. Eighth, a light force applied to periodontal ligament during orthodontic treatment is continuous in nature, whereas a heavy force is given in an intermittent fashion, right? Ninth, the fluoride concentration in most dentifrices ranges from 900 to 1500 parts per million, ppm. 10th, in a full maxillary denture, the posterior palatal seal is determined by the depth of the vibration line. So we have this anterior vibrating line and posterior vibrating line, and the extent of the posterior palatal seal depends upon the depth of this vibration line. Scrap amalgam or excess amalgam after preparing a cavity or after restoring a cavity with an amalgam restoration, the excess amalgam is stored in, so it's fixed solution, right? 12th, the least likely place for a carcinoma to occur in oral cavity, it is alveolar ridge. 13th, histologically, loss of artepex is a sign of lichen planus, oral lichen planus, OLP, right? 14th, which is the main cell type in clavicular epithelium? It's polymorphonucleosides or neutrophils. So clavicular epithelium, it's a cellular epithelium in gingiva, right? 15th, organisms involved in periodontal disease. So it's Porphyromonas gingivalis, Eubacterium, Corynebacterium, and also bacteroids, right? 16th, the most common reason for fracture of an amalgam in class 2 primary molar, it is insufficient depth of cavity. 17th, the best reason to place or to prefer an RPD over an FPD, right? So it's hygiene. So if you want to justify the placement of an RPD or FPD, then the best possible reason would be hygiene, right? Oral hygiene is easier to maintain in case of an RPD rather than an FPD. 18th, which injection poses the greatest risk of hematoma? It is PSA nerve block, posterior superior alveolar nerve block. So these are 18 points which I wanted to discuss in this first part of this video series, right? Hope it's clear.